Okay, if you get groin pain on the inside of your hip, I'm going to show you guys how we assess for internal or external hip rotation issue. It's not that common. We got John here with a hip problem. He's having some groin pain on the left hip, not this hip. This is his right one. But what we want to do is put his leg here at 90 degrees and then check internal rotation. And when you have the leg here at 90 degrees and we externally rotate his knee, so bring his ankle up towards the opposite pocket, it should reach the bottom of the pocket, and his foot does. So it comes right to here to his left pocket, and then we want to internally rotate. And it looks like it's external rotation, but the rotation is based on the hip joint itself. And when we internally rotate, you can see his ankle passes over the table here about 30 to 35, 40 degrees, and that's what we want to see. So that hip looks great. But take a look at this hip. So again, this is not something I find often. It's pretty rare. But every once in a while, I find it and we adjust it. Now you can see this foot is coming all the way up to his pocket on the right side. This is external rotation. It looks healthy. Then again, we leave this leg facing straight up, or the knee facing straight up. And then when I go to internally rotate, he's really locked. I can't even go past the table. So he's about 25 to 30 degrees short of where he should be. So when you see me internally rotate, I can't barely do, look at this, it's like 5 degrees, right? What'd you say there, about 5? Okay, so now we're gonna go ahead and adjust this hip, okay? And just in case you're wondering, folks out there, it's not a painful adjustment. And John, you're probably wondering that too, right?
As long as it feels better.
Yeah, exactly. And just relax here. And it's a pretty quick adjustment. And we're gonna do 3 here and relax here. Good. Okay, now external rotation is fine. Now we're gonna, there we go. Look at that. Look at the difference here compared to where he was before. So we got about an extra 20 degrees of, maybe 25 degrees of internal rotation. Now I want to check your psoas muscle, hands up in the air. So the psoas muscle, John, is connected into the hip joint, all the way on the inside of the groin, okay? And it's a hip flexor. So I just want to make sure everything is okay with your psoas. And I got to imagine that's really sensitive.
Yeah, I can feel it a little bit.
And it probably doesn't feel very good. Sorry about this, John. So again, this muscle is attached to the lumbar spine from T12, which is actually thoracic, L1, L2, L3, L4, L5, all the way down through the groin, and attaches on the inside of the groin, on the inside of the thigh. So sometimes, in fact, usually it's a psoas problem and not a internal or external rotation issue in the hip itself. So do you want me to keep my mask on? Or?
Take it off, I'm fine.
Okay, much better. Okay, so again, it's usually soft tissue, it's usually psoas or a pelvic problem, or even the lumbar spine. It is not usually coming from internal or external limited rotation, but for him it was, and I wanted to videotape this and show you folks what that looks like and some of the symptoms that you might have. Again, pain that wraps around on the inside of your front of your thigh or in your groin area. So John, relax yourself here. Okay, stand up. Walk around the room, I guess, a little bit and see how that feels. What's that clicking? Is that your toe or something? Heard something clicking, okay.
Try it again.
Do you want to walk down the hall and come on back?
Yeah.
Okay. So the other type of hip subluxation could be an anterior or posterior, and that's even more rare, okay? You'll find the hip either can't internally or externally rotate way before you'll find an anterior or a posterior hip, or I should say femur head, okay? Just to be technically correct. How does that
A
feel?
lot better.
A lot better.
Yeah.
Okay, great. We might need a few more visits just to clear it out, but great. All right,
Okay.
you're all set.
Yeah, thanks.
Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.